While women are also battling a gender gap in healthcare, and it's costing lives. Men, for example, are far more likely to get liver transplants. SCTV's medical specialist Avis Favreau explains there's a potential stopgap to address the disparity.
For more than 2 years, Diane Pierce waited for a transplant to save her from an autoimmune disease that was destroying her liver.
It felt a bit surreal because you're kind of on the edge all the time wondering when you're going to get the call.
What she didn't know is that the odds are stacked against women who need liver transplants, with studies showing they often wait longer than men and are up to 2 times less likely to get a donor liver.
It does bother me, and I think we need to look at what are the factors that are underlying this disparity and what we can do in order to rectify this problem.
One of the challenges is that livers from deceased donors usually come from men and are too big for women. The other, the biological tests that decide who's on the transplant list and where, also favor the men.
Now a Canadian study is showing that women can boost their odds with living donors who give part of their liver to someone on the waiting list.
In our experience, we've seen more females going the right route of living liver donation.
Diane's family launched an aggressive campaign in newspapers and online.
They built a website for me. We just blasted it everywhere. And I think there was 1,200 to 1,400 hits to the website.
Read the story.
The campaign caught the eye of Joy McGarry, who was a perfect match and who in late April, during the COVID lockdown, gave Diane the gift of life.
I would not have known at all about her need. As far as living donor donation goes, I don't know how I would have found out if I hadn't seen that article.
It's one solution to the gender gap in liver transplants.
Eternal gratitude that someone actually gave me this gift. A donor that didn't even know me.
Until doctors figure out a better way to even the score. Avis Favreau, CTV News, Toronto.